Hi, my name is Samantha, and my research group and I will be discussing our research topic this semester, which was helicopter parenting and its effects on risk behaviors in emerging adults, mediated by self-regulation. Helicopter parenting is the parental over-involvement in a child's life that is not developmentally appropriate. This may be seen as over-controlling, like trying to choose a life career for their child. Helicopter parenting can have detrimental impacts on a child, especially in emerging adults. Emerging adulthood is a period in a person's life, typically between the ages of 18 and 25, where they develop a stronger sense of personal development as they are now entering into adulthood and have more freedom and responsibilities. Individuals in college deal with more rigorous courses, increased independence, and this adjustment change can be even more difficult for someone who grew up with an overbearing and controlling helicopter parent. One reason emerging adults with helicopter parents may have difficulty adjusting is because they do not develop appropriate levels of self-regulation. Self-regulation is the ability to monitor, adjust, and adapt one's behaviors and emotions when they are influenced by internal cues or external stimuli. Self-regulation is important to look at because a helicopter parent being over-involved may unintentionally give out the impression to the child that they are incapable of being in charge of their own life. This may in turn lead to decreased levels of self-regulatory behaviors, and research has shown that individuals who lack self-regulatory attributes tend to partake in risk behaviors at higher rates. The three risk behavior variables we looked at in our study were alcohol use, drug use, and sexual risk behaviors among emerging adults. Alcohol use has been found to be the most abused substance by college students in America. Certain drugs have also been found to be highly used among emerging adults. One study found an indirect effect of helicopter parenting and substance use, especially alcohol, in college students. Another study found that individuals with lower levels of self-regulation tend to abuse substances at higher rates. Sexual risk behaviors is the we looked at and as sexual that may involve multiple partners and/or unsafe practices. College students being away from home and granted more freedom and opportunity may lead to higher rates of sexual risk behaviors and negative outcomes like contracting sexually transmitted diseases or pregnancy. Helicopter parenting may exacerbate these negative external behaviors because the parent was overly involved in their life, but now they are adults themselves and have the option to make decisions on their own, like the decision to consume substances or engage in sexual risk behaviors. Various studies have looked at helicopter parents' effects on these three risk behaviors separately, but no studies have looked at helicopter parents' effects on all three risk behaviors together with self-regulation. The purpose of our study is to investigate how the effects of helicopter parenting may present certain levels of risk behaviors in emerging adults. Based on previous research, we hypothesized that helicopter parenting would increase the likelihood of our three risk behaviors in emerging adults. We also hypothesized that helicopter parenting would result in a decrease in self-regulation in college students, which may adversely show an increase in risk behaviors. I will now pass it along to Shelby to discuss the methodology portion.
We surveyed 106 participants composed of a majority of females, with 84.9% female participants and 15.1% male participants. Our participant pool also had a majority of white participants, with 80.2% identifying as white. On average, our participants were around 19 years old, and all participants were between the ages of 17 to 25, which is categorized as emerging adulthood by psychologist Jeffrey Arnett. Participants were recruited from general psychology courses and recruited through social media. As per procedure, all participants completed a self-report survey with questions that examine helicopter parenting, alcohol and drug use, levels of sexual activity, and self-regulation. Surveys were completed through Qualtrics, a survey-taking platform. The measures utilized in our survey included the Consolidated Helicopter Parenting Scale by Schifrin et al. To measure participants' level of experiencing helicopter parenting, the Core Alcohol and Drug Survey to measure our participants' alcohol and drug risk behaviors, the CDC Youth Risk Behavior Surveillance System to measure participants' sexual risk behavior, and lastly, the Self-Regulation Questionnaire to measure our participants' level of self-regulation, the ability to control actions and behaviors. The Consolidated Helicopter Parenting Scale was created by Schifrin et al. And is composed of 10 questions, including items such as my parents supervised my every move growing up. Each item was measured on a 7-point Likert scale, with 1 equaling strongly disagree and 7 equaling strongly agree. We also included specific questions from the Core Alcohol and Drug Survey, the largest database on alcohol and drug use for secondary students. We chose 24 items from the survey, including items measuring how many times within the last year the participants have used alcohol. Each item was rated on a 9-point Likert scale, with 1 equaling did not use and 9 equaling every day. We also chose 5 questions from the CDC Youth Risk Behavior Surveillance System to measure sexual risk behaviors among our participants. Questions included items such as, did you use some form of protection the last time you had sexual intercourse? Each item is answered with multiple choice responses. The last measure used in our survey was the self-regulation questionnaire, comprised of 22 statements with items such as, I keep track of how my projects are going. Each item is rated on a Likert scale from 1, not very like me, to 5, very like me. Some items are framed negatively and therefore reversely scored. Next, Anthony will present our results.
To test our hypotheses, we conducted 2 different statistical analyses. For our first hypothesis, we conducted a correlational analysis, and Table 2 contains the mean, standard deviations, and correlation coefficients from our analysis. The only significant correlation found was a negative correlation between helicopter parenting and alcohol use, which means that a higher level of helicopter parenting can predict a lower level of alcohol use. While we found that our hypothesis was not supported, our data indicates other interesting correlations. Higher levels of drug abuse were associated with more alcohol use and sexual risk behaviors. As a result of this test, we can conclude that the data collected did not support our hypothesis. In fact, helicopter parenting was not correlated with both drug use or sex risk. In order to test our second hypothesis, we conducted 3 mediation analyses using a program called Process created by Andrew Hayes. The first analysis tested both the direct effect of helicopter parenting on alcohol risk and the indirect effect of helicopter parenting on alcohol risk through self-regulation. As a result, we can conclude that self-regulation does not mediate the relationship between helicopter parenting and alcohol risk. As you can see in the figure, there is no mediating effect of self-regulation on the relationship between helicopter parenting and alcohol risk, but there was a direct effect of helicopter parenting on alcohol risk after controlling for self-regulation, which suggests that helicopter parenting is associated with less alcohol use. Our second mediational analysis tested the mediating effect of self-regulation on the relationship between helicopter parenting and drug risk. As a result, we can conclude that self-regulation did not mediate the relationship between helicopter parenting and drug risk. As you can see in the figure, there was no mediating effect of self-regulation on the relationship between helicopter parenting and drug risk, and there was also no direct effect of helicopter parenting on drug risk. Our third mediational analysis tested the mediating effect of self-regulation on the relationship between helicopter parenting and sex risk. As a result, we can conclude that self-regulation did not mediate the relationship between helicopter parenting and sex risk. Looking at the figure, there is no mediating effect of self-regulation on the relationship between helicopter parenting and sex risk, and there is also no direct effect of helicopter parenting on sex risk. These results allow us to conclude that there was not enough evidence to infer that self-regulation mediates the relationship between helicopter parenting and all risk behaviors, and Isabel will discuss why.
Our study demonstrated similarities with past research, as there were a small number of individuals who identified as having above average levels of helicopter parenting, found also by Schifrin, Yost, et al. Additionally, 35% of our participants had never engaged in sexual activity, which aligns with previous studies which have found that the age that individuals begin engaging in sexual activity has risen over time. Our findings differed from Lemoine and Buchanan, who found that among emerging adults, those with helicopter parents had significantly higher rates of taking pain pills for something other than pain. Our results also contradicts Coy et al., who found that among college women, lower levels of self-control, which is a facet of self-regulation, was significantly related to higher levels of alcohol use, where we found a significant decrease. The majority of past research on helicopter parenting has looked at internalizing behaviors as a result of rigid and overbearing parents, such as depression, anxiety, and well-being. Darlow and al. Found a significant positive relationship between helicopter parenting and depression and anxiety, and Lemoine and Buchanan found a significant negative relationship between helicopter parenting and well-being. It is possible there is a link between these internalizing behaviors and externalizing behaviors, because those who are anxious or depressed often self-medicate. Therefore, these results are different from past research, as we did not find a significant link between helicopter parenting and externalizing risk behaviors. Our study had several limitations that should be addressed in future research. First, we had a small sample size of 106 participants, which limits the power of our study to find significant results. Second, there was a lack of diversity within our sample as it was composed of primarily Caucasian female college students, which limits the generalizability of our results. Future research should try to replicate these findings with a more diverse sample, as past research has found that externalizing behaviors are more common in males. Our lack of male subjects may have altered the results, which in turn decreased the commonality of externalizing behaviors. Additionally, our research is correlational and no causal relationships can be made. Lastly, our research was conducted during the COVID-19 pandemic, which significantly limits social, drug, and alcohol use as large social gatherings are prohibited. It also limits the number of sexual encounters due to quarantine procedures and not wanting to be exposed to people outside your household. In addition to addressing these confounds, future research should look into the possible mediating factor of self-control, as it may be better suited to mediate the relationship between helicopter parenting and risk behaviors. Hong and Kui found that self-control significantly mediated the relationship between helicopter parenting and psychological maladjustment among emerging adults. The possible implications of our research is to explore and improve on past research about helicopter parenting in order to inform parents, guardians, and educators on the effects of parenting on their children's future feelings and behaviors. Additionally, examining the relationship between self-regulation and risk behaviors can provide valuable insight on the importance of being able to control emotions and behaviors in a socially acceptable way and its relationship to risk behaviors among emerging adults. Thank you for your time, and if you have any further questions, please comment below.